Hello, today I have as a guest Dr. Toni Engram. I'm going to pull her up right now. She's a holistic dentist. Let me finding her. Okay. There she is. All right. Hey, thanks for joining. There she is, Dr. Toni Engram. Hey, great to have you on
Hey,
live with Autism Transformed. Yeah, for those of you who don't know me, I'm Luminara Serdar. I am the founder of Autism Transformed, and I help parents to help their children to shift their autism behaviors by getting to the root causes. We want our kids to be more calm, connected, communicating. And I've invited Dr. Toni Engram, and you are out of Richardson, Texas, correct?
correct. Correct. Just right outside of Dallas.
Yeah, a holistic dentist. And go ahead and say something about yourself for everyone watching.
Well, I am a holistic and biological dentist. I'm also an integrative health coach. But the way that I practice, I see my most important role as mama. And so in my office, we treat and adults of all ages, all different backgrounds. And really, my role as a mom is most important to me. So we're looking at these root cause issues of oral diseases, whether that's tooth decay or gum disease or whatever the case may be, and how that impacts the family as a whole.
I love that. I love holistic dentistry because for so long, mercury fillings have been the standard, and just I think practices that maybe don't really benefit the patient. And I took your cavity cure course, and I really loved the elements you walk through in that. So, for people who don't understand holistic dentistry, you did say root cause, but can you go into a little bit more first about holistic dentistry? Then I want to shift a little bit more to kids and holistic dentistry.
Yeah, absolutely. So, a lot of what biological dentistry is all about is not as much the what we do different, but a lot of it is the how we do it differently. So, we're much more intentional with the products and the materials that we use. We believe really, first and foremost, that dentistry should be safe. So anything that we can use that is safer, more natural, then that's what we want to do. Um, we do incorporate some other fun techniques, like ozone is a really neat tool that we have. We're looking for things that are, one, that they're safe, and two, that they're more effective. We know that dentistry and oral health in general is so intricately related to your overall health. You absolutely can't be healthy without a healthy mouth. And so a lot of biological dentistry is, let's do the dentistry safer, and let's make sure that your mouth is as healthy as it can be so that one is impacting the other in a more positive way.
So you mentioned you do safe practices, and could you touch on, I know you don't want to, diss the whole dental industry and what's not safe, but you mentioned ozone as being safe. Could you say a little bit about things that you would not use because you don't feel like it's the safest for the body, and things that you would use that you feel are safe?
Yeah, absolutely. So when we're talking about um, some of the fun, more controversial topics around dental care, really, fluoride has been a tool that has been helpful in reducing cavities to a certain extent for many, many decades. But the more research we do, the more that we're finding that there's more risk to fluoride than we originally thought. And there's maybe not as much benefit as we originally thought as well. So for me and my family and in my practice, we've chosen to avoid fluoride in all of our dental materials, which is kind of tricky to do. Everything that I buy just about has a fluoride option, or has fluoride in it. So we're very intentional in avoiding fluoride. We filter it out of our water. We filter it out of the water of our home as well, because that's where the studies I think are most concerning more recently, is the fluoride that's in our water supply and how it's linked more and more with decreasing IQ in our children. There's actually a lawsuit right now against the CDC, not the CDC, I'm so sorry, against the EPA around fluoride in our water supply. So I think that's one area where, yeah, we're trying to avoid fluoride as much as we can because it's in our water supply. It's everywhere. We can't avoid getting exposed to fluoride. You know, if you open up a can of vegetables, then chances are it's packaged with water from a municipal water source that has fluoride in it. If you drink a soda, then it's made with water from a municipal water source that's likely fluoridated. So it's, like I said, it's everywhere. We can't avoid it altogether. So in my office, we're really trying to minimize that exposure. I know in a lot of materials you're talking about mercury, and I know that is a huge concern. Thankfully, there aren't that many dentists who are placing the mercury fillings in children anymore. It's become far too out of style to place them, except for, just a few die-hard dentists who still use it and love it. But the thing that exposes us to mercury from those fillings is when there's heat and friction applied to the filling.
And what
And
do
if
we do when we chew?
exactly, every time you chew, every time you grind your teeth, every time you brush your teeth, you're going to have these teeny tiny little exposures of mercury vapor, and it's not going to just go away. The mercury in those fillings has a half-life of 50 years. So it's going to be there as long as that tooth is in your head, most likely. But when that dental work needs to be replaced, what am I doing? I am taking a high speed drill and applying a lot of heat and a lot of friction to that filling in order to remove it and take it out. So that's one area where I think biological dentistry shines, is we go above and beyond the standard of care in our mercury hygiene, and we are making sure that we are removing those fillings in a very intentional way to minimize exposure of the patient to mercury, but also to minimize exposure to myself and my assistants.
Right.
And so those are kind of the biggies. Let's see, any other biggies in dentistry? Root canals are super controversial and fun to talk about. And thankfully, I don't know that any of your kiddos have root canals in their mouth. Thankfully, I'm sure some of the moms do. Probably many of the moms do, and that's a really fun, nuanced thing if you want to get into it. But I know we've got lots and lots of stuff to talk about.
Yeah, and you mentioned ozone earlier, so I would love to hear a little bit about how you're using ozone. I know we use it for adults, but I'm curious if you've used it for kids, so if you could just tag that on. Yeah.
I do use it for kids. So ozone is a really strong oxidizing agent, but very, very natural, very safe. It's medical grade ozone. So we take medical grade oxygen, very, very clean, and we run it through an ozone generator. It adds an electrical charge to the oxygen, creating O3 instead of O2. And that O3 is what works the magic. It's very unstable, and it breaks apart any dead or dying cells that no longer serve us. It is really effective at killing bacteria and viruses, and can help wash those things away. at the same time, it upregulates our own immune response. And so it gives us like this nice little immune boost, this boost of oxygen in our cells. How we use it on adults is all kinds of ways. We are applying the gas around gum tissue to make sure that we're healing gum tissue, treating those inflammatory conditions like gum disease, treating tooth decay. We can inject it to help with sensitive teeth. And we actually ozonate all of the water in our dental office. So all the water that comes through our drills, that comes through all of our tools, is all ozone water. Um, Now on kids, it's a little bit different because the one thing that you want to avoid with ozone is you want to avoid breathing it in and getting your lungs exposed to it, because it is a pretty good lung irritant. If you accidentally take a big mouth breath of ozone, then we wind up with a coughing fit for about 15 minutes and then pretty much the appointment's over. Ask me how I know that. So I don't use the gas very much on kids unless I'm able to like suction really well and it's an older kid that I know can breathe through their nose and follow instructions really, really well. And I don't inject it on kiddos unless the child is already numb, because the ozone burns if it's injected into the soft tissue. So we try not to do that for kids, but definitely ozone water we use for everything. And then we can use some ozone oil on kiddos too.
Oh wow, thanks for explaining that, because I didn't know some of those nuances. And you said if you breathe it in, it can irritate the lungs, but if you swallow it, it's probably no big deal, right?
Really fine. Yeah.
Okay, cool. And I've used ozone oil on my teeth and gums. So can you share a little bit about why that would be beneficial for, well, kids and for parents, for anybody?
Yeah. So you get the benefits of ozone, but also the benefits of the oil too. It's a gentler way to apply ozone, so you still get a lot of those benefits of reducing inflammation, improving the immune response of the cells, killing bacteria, but in a much more milder form because the ozone is run through typically olive oil.
So if someone were to use that at home, like I did, how, what would be the indication they would use it? And how would they use it? I'm thinking of a kiddo who might have, I've heard of kids on the spectrum with like black, their teeth get stained. I've heard, and I have a feeling it's just related to infectious agents. So that their teeth get stained, or that they just have, a large proportion of bad bacteria in their gut, which kind of indicates it might be going on in the mouth. So, kind of addressing those things.
I think that's a great application for it. As far as, removing the stain itself, I don't know that it would be very helpful, but as, to help eliminate whatever the source of the stain is, I think is a great idea. And one that I had not thought of for kiddos that have a lot of stain on the teeth. How I use it is anytime there's a wound in the soft tissue, then we'll use ozone oil quite a bit because it can help those areas heal a lot faster. And then sometimes we'll use it, our families that are taking their kids through a re-mineralization protocol. Basically, we're trying to heal cavities. Then they'll either apply the oil, like just apply the goopy stuff, or they'll do some oil pulling with one of the pre-made ozonated oil rinses.
Well, I'm just thinking of kids who can't communicate well, or can't say how they're feeling, or very sensitive. That you're probably not going to get them to oil pull, like to swish oil in their mouth and spit it out. Probably the more likely thing is to rub it on,
Yep,
right?
absolutely, absolutely. Yeah, and that's so funny with our patients on the spectrum who obviously there's a wide variety of how sensitive they are to different sensory stimulations. And so some can handle any kind of oral hygiene task we give them. And some really can't. Some struggle just with brushing their teeth, or even with mom or dad trying to brush their teeth for them sometimes is a struggle. So it's always, this give and take, like what is this kiddo able to do, what are they just not able to do, and kind of working from there.
Yeah, I have a kiddo I'm working with who it was a big win for him to start brushing his teeth independently. So, in my practice, we reduce the toxin level in the body, and then these things start to straighten themselves out. And this little boy needed help. He's 11, I think. He needed help every day, and then he started wanting to do it on his own, and now he's doing it well on his own. So, we want to see our kiddos progress, but yeah, you're right. They're going to be at different levels of independence or motor skills. So I'd love for you to say like any tips for parents. And parents, you can, whoever's listening, you can type anything into the chat and ask your question. But I'm curious, what would be great for a parent to prepare a special needs child for a dental visit? For helping to calm, nobody loves sitting in the dentist chair and loves that sound of the dentist drill. It makes us all anxious. So what do you suggest for even before they come in for the visit or when they first get there?
That's a great question. So I start even with our babies that come in, because we do a lot of tongue tie revisions on infants. And so I always tell moms, the more you're in their mouth, the better. And the more we can desensitize some of those sensory reflexes, the better we'll be to have a good dental relationship down the road. And so I think the advice would be the same, really. The more either you or your child can be in their mouth and just desensitize things to having fingers in the mouth, getting comfortable with that being normal, and making it a fun thing and not a scary or uncomfortable thing, I think is really helpful. And so for, like, let's say you're trying to prep your child for an appointment where they need a filling. That's where we really want to talk up how fun it will be and not talk up your own stuff around the dentist.
Or not to have the parent get anxious themselves because kids are picking up on that energy.
Absolutely. Absolutely. Um, and so it's always a challenge. A lot of times I see families who come from a background of, they're fearful of any kind of healthcare provider, maybe because they've had a bad experience or where they weren't allowed to be a part of the process. And so we want the parents to feel safe, like we're all on the same team. We're all, trying to do what's best for the kiddo that's in front of us, the kiddo that's in the chair. But the unintended side effect of that is that having parents in the room, the parents bring with them their anxiety, and the kiddos feed off of that anxiety 100% of the time.
And I hear from a lot of parents that if their child is going to have dental work or cavities, they just do general anesthesia. And I have concerns about anesthesia because I feel like those chemicals really attach to the nerves, especially the fatty part of the nerves, and can have effects down the road. So can you speak a little bit to that?
Yeah, absolutely. It's something that is always a balancing act for us. Sometimes it just is necessary. It's necessary, it's needed to get the job done. And if it's necessary, then we want to make sure that they're working with a functional medicine provider or a naturopath to make sure that they're getting some detox support afterwards. I know a lot of my referring docs will put their patients on a nice high dose of vitamin C, some methylated B vitamins, and glutathione after sedation to help the body detox as best as possible. Let the body do what it is designed to do. Um, but yes, anytime we can avoid doing sedation or do minimal sedation, then that is absolutely what we want to do. We just have to balance that with making sure that we're doing so in a way that is kind and not pushing the kid too far to where we can still do the work that we need to do safely.
That's great. And, you know, I'm all about detox and I'm about living a detox lifestyle. So I love that you said after the dental work, they get some kind of, you know, detox help. I would also add that I think binders are really important, and I'm not sure exactly what's the best one that binds up anesthesia, but activated charcoal is usually a pretty good one, overall one, if your child's not constipated, because it can be constipating. So if you do give activated charcoal as a binder after dental work to help with the anesthesia, you'll want to give something that if your child tends towards constipation, you'll want to give something that also helps them poop better. Now, Dr. Toni, you also mentioned that you help kids remineralize their teeth if they have cavities. So I would love for you to speak to that because, you know, like we just said, no one wants to go get their cavities filled. If we can remineralize, I guess, catch them early enough, can we fix the cavities and not have them like get deeper that they need to get filled? And how would you do that?
Yeah, it really takes all hands on deck to make it happen, but it can happen. If we can catch those cavities when they are in the enamel, meaning they are small, there's not a visible hole in the tooth, then absolutely we can do our remin protocols, as I like to call them. So yes, ozone oil is really helpful. There are lots of different tooth putties that you can find online that a lot of my parents will use. We want to make sure that they are using a good toothpaste that or something that contains a nice dose of hydroxyapatite so that the tooth can absorb some of those minerals from the outside. And then optimizing diet, making sure that they're absorbing the minerals, focusing on gut health, getting lots of good healthy proteins and healthy fats. Then all of those things combined, plus, you know, your normal reducing sugar where you can, um, using some xylitol and some other tools to help address the pH and the microbiome. All of those things combined can help us heal those small cavities to where hopefully we don't have to do any dental work, or at the very least, it can slow it down and give us time.
Mm-hmm. You mentioned xylitol, and that's like a sugar substitute. It's kind of minty fresh. It like leaves your mouth with like a freshness, is the way I can describe it. But can you recommend? I have I can't remember what the name of the gum and the mints are. Spry. That I have Spry gum and Spry mints, which has xylitol. Could you recommend something? And those are highly minty, and that might be a flavor too strong for kids. Could you recommend something with xylitol? So, like after they eat, to even have xylitol will help balance the microbial flora in the mouth, right? And then, what could they use for that?
Correct. So xylitol is a sugar alcohol that is from plants. You want to source it correctly because you can find xylitol that is made from corn. And as your audience probably knows, most of the corn in the US, if it doesn't say otherwise, it's mostly genetically modified. So if we can avoid xylitol that's from, you know, some of the big brands where we know it's probably from corn, then I think that's better. Spry is one of the ones that sources their xylitol from birch trees, which I think is much safer, a much cleaner source. And I really like that product. I sell it in the office, but there are several. Xylitol itself tastes very similar to sugar. And so it doesn't have like that stevia sometimes aftertaste
Aftertaste.
yet, which I like. And there are plenty of products that are sweetened with xylitol that aren't minty. Even Spry makes some, they make a product called Sparks with an X, that are like berry flavored. They look and taste kind of like Nerds, that candy that we used to eat in the 90s and we probably shouldn't have. Um, so lots of different xylitol products that are out there, and that one is, there is some nuance to it that I think is important for families who are dealing with anyone on the spectrum, because any sugar alcohol, including xylitol, is it acts as a prebiotic, meaning your digestive system does not process it very well. So it can go straight through. And if you've got somebody who's super, super sensitive to sugar alcohols, it's possible that they're also sensitive to xylitol. And so if that's the case, then you want to stick with sources of xylitol that are mostly going to stay topical, mostly stay in the mouth without ingesting a lot of it.
And what's a product like that? Do you have something that you sell in the office?
I would say most toothpaste and gums and mints are gonna be just fine. But no, if you start a xylitol product and all of a sudden you see GI issues that you didn't have before, like gas, bloating, diarrhea, then there's a chance that it could be they're just super, super sensitive to xylitol and you'd want to cut back a little bit. But most of the time, oral products do just fine. I just don't want people to go out and buy the packets of granulated xylitol and start baking with it. That's where I think we really are more likely to run into trouble. But when you do it like that, just these oral health products, then yes, like you said, having it after meals, not only will it give an immediate raise in the pH, which is fantastic. That's what we want to help combat cavities, is we want to neutralize acids as fast as we can after meals and snacks. But over time, the bacteria that cause cavities will ingest it, but they can't metabolize it. So over time, you get this really nice shift in the oral microbiome to where they've got less of this cavity causing bacteria, and it'll select for more of those beneficial bugs that we want to have in their mouth.
Then when we have more of those beneficial bugs in the mouth, we have less likelihood to get cavities. Is that right?
Correct.
Awesome.
Correct.
Can you recommend some toothpaste or oral care stuff? And then after that, I would love for you to talk about your cavity cure program, because I thought that was awesome. So,
yeah. Absolutely. I have most of my patients on a re-mineralizing toothpaste that's fluoride free and has calcium hydroxyapatite in it. My two of my favorite brands, there are a lot of good brands, which I'm excited about. I think each year there's a new product or two on the market. So these are not the only ones by any means. They just happen to be my favorites and my patients like them. Risewell is one, and Risewell, I've been with them since their early days, and they've been a huge supporter of us, and I love their transparency in choosing their ingredients. So I think Risewell is a great brand of oral products to use. And Boca is another patient favorite because they have lots of different flavors. They've been around for a little bit longer. Their toothpaste, everybody has their favorite because one's a little grittier, one's a little spicier. And so everybody in the office can kind of pick their favorite as far as toothpaste goes. Now, if we are reducing the risk of cavities, Risewell also has a rinse. And there are very few rinses that I like and that I promote, but Risewell's is one of them because it has baking soda in it and xylitol, which can raise pH. It has some nice herbs that help with the balance of bacteria. It kind of selects for a nice microbial shift over time without having alcohol or without having anything that's so harsh that it's going to kill the good bugs with the bad.
That's awesome. And Risewell and Boca, the two brands you mentioned, are they in stores or do people just get those online?
You can get those online. Have I seen them in stores? I don't think I've
I
seen them,
haven't heard of them
but I
before.
know you can get them on, I know Boca you can get on Amazon. And both of them have nice functioning websites where you can get like auto ships if you want to, I think.
Hmm. I like to use the brand Xylitol. I'm curious what you think of that. I just get it in the health food store.
I have seen it. I think I've tried it and I like it. I don't remember what all the ingredients are, but most of the time you find it in a health food store, it's probably going to have pretty clean ingredients.
Awesome. And then can you tell us about the cavity cure? And I think that's really more of a whole dental health care from the toothbrush you choose to helping with prevent cavities. Can you say a little bit about that?
Absolutely. Absolutely. And I'm so excited that you took it. That's amazing. So I had I just got frustrated that I didn't have enough time to spend with my patients to give them all of the tools that they needed to prevent and reverse and heal their cavities and stop them from coming back. So I've got a couple of options now and a new one since you took the DIY course. So the one that you took was the Cavity Cure online course that's completely do it yourself. It has all the modules that you need, all the materials that you need to prevent, reduce, heal those cavities. It's got all of the information. Um, in my office, I offer a one-on-one program where we're really digging into some salivary testing and honing in on those root cause issues with each family. And then because I needed something kind of in between, we are launching a cohort of our group program. We're actually launching it next week. The first session is next Thursday. So I'm really excited about that. That one is going to be all virtual. You don't have to be in Texas in order to do it. And we're going to do live sessions, live Q&As, all of the same information that's in the DIY course, but we'll be able to hone in and support people better by having them do it as a group.
Will you please make sure to send me a link so I can put that in the chat or the bio or something? Or is that in your link in your bio?
And I don't know if that one, I will make sure that it is.
Yeah, because we want people to be able to access that, access both of them. And so the difference between your do-it-yourself and the one you're launching next week, what's the difference?
The difference is we'll be able to fine tune the needs of the group because we're going to do it live. So you'll still have, if you do the group program, I'm still going to give everybody access to the DIY course. So you'll still have that. It will just include now discounts on salivary testing. We'll go over salivary tests in a group for anyone who's comfortable going over those in a group. We'll do some pH testing and then the live Q&As that are going to be directly with me.
Okay, so if we have a parent here with special needs, with autism, and I know so many I talk to are afraid to bring their child in to the dentist, and they kind of put it off and avoid it as long as possible. Would this program be something that they want to do? Like how would they, you mentioned the salivary testing and the pH, would that help them to determine like how long to put off going to the dentist or if they need to go or not? Would that give them good information on that?
I think it'll give great information. I always, this is where if we're doing something virtual, then I'm your coach. I'm not your dentist if we're doing something that's all virtual. So I will absolutely be able to support them in making sure that when they do go to the dentist, that they know what questions to ask. They know how to find a dentist that's the best fit for their family. But I don't know. I won't say that you can put it off just because I think it's so important to get that one-on-one to make sure if there are trouble areas that need to be addressed clinically, we want to make sure that we address those clinically. But I can absolutely give guidance on how to make that happen safer in a way that makes parents feel more comfortable.
That's awesome. And do you have a resource where, we know you're in Richardson, Texas, and some, maybe some people watching this are near you and can come to you, but do you have a resource if someone's in, New Jersey or New York or somewhere else where they could find a dentist like you in their area?
Absolutely. Absolutely. So one of the biggest organizations that provides training and continuing education for biological dentists is the IAOMT, and it is a ridiculously long name, and I apologize. It stands for the International Academy of Oral Medicine and Toxicology, and it took me probably 3 years to be able to say that without stumbling over the words. But it's an amazing organization, and it's growing really rapidly because thankfully dentists are waking up to the fact that dentistry can be better, dentistry can be safer, and that we can treat our patients even better by making sure that we take all of these things into consideration. So if you go to their website, it's IAOMT.org. And there is a really great directory there where you can absolutely find a dentist that is in your state and hopefully close to you. But it also says, how many meetings has that dentist attended? Did they just sign up just to put it on their website, or are they actually active and involved? It'll say their level of certification, if they're certified to remove amalgam fillings safely. It used to even have if they use fluoride in the office or not. So a really great resource, and they have lots of information that's designed for patients, for the public.
That's awesome. Thank you so much for that resource. And I guess, if you don't see the information you want to see for that dentist, you could always call the office and just ask, some probing questions, and you'll probably get an idea. Our parents with kids on the spectrum have kind of been through the ringer with doctors and other providers. So they're usually pretty good at, their bullshit detector, or their, good doctor detector, whatever you want to call it.
For sure.
Just by the way they're talking. So any last words you want to leave us with, Dr. Toni?
Well, first, I want to say thank you for having me. This was a great conversation, and your community is so precious. And so I'm really grateful for the opportunity. If there's something that I can do to support them in any way, absolutely reach out and let me know. And the one thing that
your Instagram handle is
at Dr. Toni Engram. Tony's with an I, Ingram's with an E. It's weird.
Yeah, and we'll also put all this stuff in when we post this as a reel. We'll put all this stuff into the caption so people can find you.
Awesome. And I would say just have hope. No one was born with bad teeth. You don't have bad teeth. Your kids don't have bad teeth. There's hope. The body was designed to heal, and that's what I hope that every family knows within, is that they are designed to heal.
That's a great message to everyone. Thank you so much. I really appreciate your being here because I love what you do, and I love to share amazing people with my audience. So thank you.
Likewise. Thank you so much.
Yeah. Oh yeah. All good days are so informative. Thank you. Awesome. Thanks everyone for joining. Appreciate you.
Thanks, guys.
Bye. Bye.